Dr. Holler is here with us today talking about his recent publication. And we want to ask him really about, his experience and want to talk to you today about ATG.
Sure. I'm Dr. Michael Haller. I'm a professor in chief of pediatric endocrinology at the University of Florida. I've been here at the University of Florida my entire academic career, where I focus primarily on type 1 diabetes, trying to understand the natural history of the disease and how we can interdict it to prevent and one day hopefully reverse it. In June of this year, I'm taking over as the chair of the NIH-funded Type 1 Diabetes TrialNet, which is a large consortium of type 1 diabetes clinical trial centers across the US that runs many of the clinical trials that hopefully will one day lead to drugs that we get through the system. In fact, tepluzimab or Tzield was approved for patients with stage 2 type 1 diabetes because of a study that we ran through TrialNet. Hopefully, we'll be able to have many more successes like that in the future because of that work.
Tell me a little bit about your recent publication, but more like what is ATG? This is a molecule that's been around for a long time and it's being used now to treat type 1 stage 2.
Anti-thymocyte globulin, or ATG, trade name is thymoglobulin, is a drug, but it's really a biologic drug that's been around for 40 plus years and is used every day in major hospitals to treat organ transplant rejection. Our group has been interested in repurposing it at a much lower dose than is used in transplant to try to find a Goldilocks zone where we give enough of it that it is immune modulating, but not so much that it's truly immunosuppressive. And through a number of clinical trials that we've done over the last 15 years, we found that a very low dose of the drug is capable of preserving beta cell function and reducing hemoglobin A1C in recently diagnosed patients.
So ATG is it given in an injection or is it an IV infusion like Tzield? We know Tzield or tepluzimab is a 14-day infusion, currently FDA approved. So is this given IV every day, or how do people get it?
ATG is given as an IV infusion over about 6 hours on 2 consecutive days. It's only a 2-day infusion. The infusions are significantly longer than they are for tepluzimab, but you're done after 2 days as opposed to having to come, and get an infusion for 14 consecutive days.
And the cost of this medication, like out-of-pocket cost for patients, a high cost drug, or is it generic, or what?
Well, it's not a generic because it's only made by one company, because it's a very challenging drug to make. It's a biologic made by taking human thymus tissue, T cells, and immunizing a special